Hi, welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mele. We are talking about all kinds of plastic surgery procedures. Yeah. And let's talk about facelifts.
Okay.
And versus neck lifts, because a lot of people get those confused. They think everything's going up at once. So what's the difference?
And I think most of the time that's true. Everything is kind of going up at once because the face, the lower part of the face and the neck are intimately involved.
Right.
And they tend to age together. So often when we're doing a facelift, we're addressing the neck. If we're doing a neck lift, it's someone whose face looks really good, and maybe they just have loose skin at the neck, or they're starting to get a little bit of jowling, and we'll concentrate on that. So I kind of consider them the same procedure. It's just where I put the focus depends on what's going on.
And women's necks seem to, I mean, a lot worse than men's as time goes by. And I notice a lot of creping on women. I don't notice it on men. Can you get rid of that with just a simple neck lift?
The creping, if the skin is loose, it's redundant. Then that goes away with the neck lifts.
Oh, okay, good.
If the skin is just really kind of crepey, not so much. I mean, it'll go away temporarily, it'll go away while they're swelling, but usually you have to do something to the skin itself, like a peel, or use a laser, or use filler, something to get those finer lines to go away.
Oh, I hate that. All right. So how long is a facelift, and what do you do?
Facelift, the time it takes varies by what I'm up to. It can take anywhere from an hour for mini facelifts to 3-4 hours if we're moving everything around, especially if there's really dense banding here. Some people see a pair of kind of muscle stripes coming down. That's the platysma muscle.
I hate those. Can you get rid of them?
No one seems to come in and ask for those, so I think everyone hates them. But I think what happens is they're separated a little bit. And for some people, they're separated all the way down, so they get big, long lines running up and down. And essentially what we do with part of the facelift is make a little incision underneath and sew those together like a little corset inside to support everything underneath the skin. And that way the skin isn't trying to fight the muscle. Because if they're not addressed, the muscle keeps stretching out that skin and brings the looseness back more quickly.
Are you talking about, would that be a neck lift or a mini facelift? Because what's the difference
between... That's more of a neck lift. Mini facelifts, I love them. They're great procedures. The recovery time is really short, but they're not great for the neck. They're great for jowls, or great for the sides of the face. Here, it just seems to come back in a year or so, much quicker than with a real facelift.
Oh, I hate that. All right, so what about healing time if you're getting a facelift?
So healing time, again, similar to the eyelids, it's more that how it looks rather than how it feels. If someone has a lot of pain after a facelift, I need to see them in the office to see what's going on. It's not a painful procedure. It should not be.
Good.
Once in a while, there'll be a little bit of bleeding into the skin. Even if it's a small amount that we could ignore, it hurts. And if that's going on, I just want to be sure there's not a lot of bleeding. Also, infections cause pain. So if someone's having a lot of pain and worry maybe there's an infection starting, the face has such a great blood supply, infections are very, very rare.
How do you know if you got a bad facelift? I mean, how do you know?
It's up to the patient, really. I mean, I do what I need to do, but the final judge is my patient. And if they don't like the result, it's a bad facelift. And we got to find a way to make it better.
Oh, geez.
It makes it harder, huh?
It does. that's not a good answer. I mean, we want to know if... I mean,
it's a fun job. But I think I can always make a bad facelift if I make the skin too tight, if I remove all the hair from around the ear, I pull the hair back or bring it away from the top of the ear. With men, we can actually get away with that because we grow beards. And the hair will grow, we just shave it a little bit lower. But for women, this hair is kind of special. And if you pull it way up high, it looks matronly. You don't want to look like Queen Elizabeth. I mean, you don't want the hair pulled so far up that it's off the face. And there's been some patients I've seen were doing a second facelift where that skin has been pulled too tight or the hair's been moved, and then I'm trying to work to tighten the skin of the face but bring the hair forwards. And there's ways to do that, but it's more challenging.
And so men and women both very popular facelift?
Yes.
For both? Okay. Well, that's interesting. Dermal grafting you mentioned. What is that?
So dermal grafting is a way to fill in primarily the lines that form around the nose and the mouth. So those deeper lines where we would usually use Restylane, Perlane, Radius, all those fillers and Juvederm. In order to get a longer lasting result, especially when it's a very, very deep, densely attached line, I'll take some of the skin that we would throw out from a facelift and get rid of the outer surface so it doesn't make oils, and bury it underneath here. So it works like a filler, but it's your own skin, it's your own collagen. The body tends to maintain it. It doesn't last forever, but it lasts years. And even if it doesn't completely correct that wrinkle, the fillers work so much better on top of that dermal graft because now we've got a foundation to work off of.
Do you also, with dermal grafting, do any fat grafting of the face?
You can do dermal fat grafts where you just leave some of the fat on the dermis. The nice thing about dermis is it's a big, flat, smooth surface. The problem with fat grafting is sometimes it's a little lumpy. And if we're fat grafting into the buttocks, not a problem. But if we're fat grafting into the face or the lips,
you don't want it to be
don't want any lumps there. So I do use dermal grafting for lips also.
Fantastic.
But now that we have these fillers that last 6 months to a year, it's hard to beat them. I mean, nobody wants to have to maintain it, but the results are just so much better than we can get with a lot of the alternatives.
Love those. All right, for more information about Dr. Mele, you can call 925-943-6353 or check him out on the web, drmele.com or sanfranciscobreast.com. And like I said before and after pictures on his website, drmele.com. Stay with us. We'll be right back on Body Beautiful with lots more topics.